Hi, Dr. G. My name's Danielle Kawryga. Thank you so much for taking the time to meet with me. This facility is beautiful.
Thank you. It's so nice to meet you. So can you tell me a little bit about yourself?
Yes. I grew up just outside of Syracuse, New York, in a small town. I graduated from Ithaca College in 2016 with my bachelor's in clinical health studies, and I also dual minored in anthropology and art history. In 2018, I received my doctorate of physical therapy from Ithaca College as well after completing 4 clinical affiliations. And recently, I developed a passion for long-distance running, so I've dabbled a little bit in gait training and biomechanics, which has really become a passion of mine.
Interesting. So what makes you interested in this position?
So I noticed that you have an amputee rehabilitation program, which I think would fit very well with my interest in gait and biomechanics, because I think the two coincide together as patients retraining to run, walk, whatever they would like to do with their prosthetic is a critical part of a full and functional recovery. I'm also very interested in the continuing education opportunities that you offer, because I think the profession is always evolving. We always need to stay up to date on the literature, so I'm very interested in that.
That's great. We really do value continuing ed. So can you share some of your strengths and weaknesses?
So for my strengths, I think I have great communication skills with patients. I've really developed a way that makes it comfortable and easy to talk to patients, to explain to them why we are doing a certain activity, how it's going to benefit them, and how to do it in a way that they can understand. I also think that I'm motivated and a very fast learner, and which makes me able to work in a variety of rehabilitation settings, such as all of the ones your hospital has to offer. Some of my weaknesses, I get a little detailed on my documentation sometimes, which can hinder my time management, but I'm working towards resolving that, only adding what's important. Another one of my weaknesses is that I lack clinical experience in certain patient populations, such as neurology, so I think that could really hinder my differential diagnoses on those patients, but I'm willing to work more in those populations to alter that.
Good. What I like to hear. So where do you see yourself in 3 to 5 years?
In 3 to 5 years, I would like to see myself working in a large rehabilitation facility such as your own. I would like to be specialized or nearing my certification of being specialized in a topic of interest such as orthopedics or even the biomechanic field of it. I would like to be actively involved in the community, giving community lectures or information sessions on topics such as running biomechanics, training for races, and I would also like to complete my own full marathon. I've only run half marathons thus far.
Nice. It's more than I've done. Can you tell me about a challenging situation with a patient or staff member?
One of my most challenging situations that I had with a patient was when I was working in a skilled nursing facility. I would go into this patient's room, try to get him up for therapy. Some days he would go willingly, some days I couldn't get him out of bed. When I got him to therapy, he wouldn't want to do any of the exercises. He was rude to other patients. He did not want to be there. So one day I took him aside, asked him why he wasn't following the rehab protocol, and he explained to me that his previous therapist never explained to him why he was doing the exercises, what they were doing to help his functional recovery. So I took him aside, and we spent that whole 30 minutes that I saw him that day explaining his plan of care, going over what exercises we were going to do, why we were doing them, and why they were going to help him in the future. And I never had a problem with him coming to therapy after that.
Are there particular types of patients that you like to work with?
So, as I mentioned before, I'm very interested in working in the amputee population with their prosthetics, that gait training that I talked about. I also have an interest in acute care, so the acute care section of your facility, because I've always had a passion for working with patients that couldn't help themselves, can't get themselves to a full recovery, and they really rely on a therapist. I would love to be there when a patient takes their first steps after about 6 months they've been bedridden, and I've always really looked forward to really helping patients that way. I'm also very interested in the orthopedic part of physical therapy and working with orthopedic style patients, because I've had the most experience with those working in the on-campus OT-PT clinic at school.
Okay. And lastly, do you have any questions for me?
Yes. So what are the typical hours that an entry-level physical therapist works at your facility?
I would say it varies, but pretty much 8 to 4, 5 days a week, because patients do need rehab in our facility every day. So it just varies. Yep.
And do you like working here?
Yes, I love it.
Great. Well, Thank you for taking the time to meet with me. I brought a copy of my resume,
Okay, thank you.
and I was wondering if I could take one of your business cards.
Yeah, I have one right here.
Great. Thank you so much.
You're welcome.
It was a
Thank
pleasure.
you. Nice to meet you.